Hello, my name is Caitlin Hildebrand, and today I'm going to be talking about the bones of the body. So bones are living dynamic tissue. Bones help support the entire body. They also create red blood cells, and they work to support muscles and as levers, as well as they store calcium and fat. The classifications of bones often happen in shapes. So those shapes include the long bone. Long bones they have a long shaft and they go out on the ends. So this is an example of a long bone. This is your femur. And then we have short bones. Short bones are cube-shaped bones that are smaller. An example of this would be in your carpals or in your wrist. And then in addition to that, we have flat bones. So flat bones are thin and flat bones. Sometimes they're curved a bit. So here we have flat bones as our ribs and our sternum are two examples of flat bones. And then we have our irregular bones. So these are just irregularly shaped bones. An example of this would be a vertebrae, would be an irregular shaped bone. And then finally we have our sesamoid bones. Sesamoid bones are within ligaments or joints, and such as the patella right here. So a sesamoid bone is in your patella. So moving on, we're going to talk about our axial skeleton, and then we'll talk about our appendicular skeleton. So the axial skeleton involves the skull, the cranium, the facial, as well as the vertebrae column and the thorax. So we'll start with the bones in our cranium. The first being our frontal bone right here, and then we have our perineal bones right here, and then we have our occipital bone in the back right here, and then on the side we have our temporal bone and our sphenoid bones. All of these bones are connected by sutures, which is kind of hard to see right here, but there's sutures that connect these. Those sutures are loose as you are a child and a baby, and then as your brain and head grows, those sutures will come in and tighten up. You can also see your sphenoid bone in here. It's the shape of a bat right in there. And then there's also the ethmoid bones right past that right there. In addition to that, we have our hyoid bone, which is just under your jaw. And then we also have our auditory osseous, which is further into the skull behind the temporal bone. But these are three tiny bones that create your inner ear, and these bones help you. They make you able to hear. So as far as the facial bones, we have our maxilla, which is the bone right here. You have your mandible, which is your jawbone. You have your zygomatics, which are your cheekbones right here. And then you have your nasal bone, which is the bridge of your nose right here. The rest of your nose that protrudes out is made up of cartilage. And then you have your lacrimal bone, which is on the medial side of your eye socket. And then in addition, we also have our inferior nasal conch, which is right up in there, and so is your vomer. Your vomer's up here too. And lastly, we have our palatine, which is up on the roof of your mouth. So moving on to our vertebrae. Your vertebrae, the first part of your vertebrae is your cervical vertebrae. So that's the first 7 of your vertebrae, C1 through 7. C1 is your atlas, because it keeps your head up and standing. And then your C2 is your axis. So your axis allows your head to move and swivel. Moving down, you have your thoracic vertebrae. These are labeled T1 through 12. Your thoracic vertebrae allows you to articulate your rib cage and allows your body to move better. And then your lumbar vertebrae is the next vertebrae. There's 5 of them, so it's L1 through 5. And then moving down, you have your sacrum, These are 5 fused together vertebrae that used to be 5 vertebrae, now they're just 1 bone. And then lastly, you have your coccyx, commonly known as your tailbone. These were also like 3 to 5 vertebrae that were fused together to create 1 bone. So the last part of your axial skeleton is your rib cage. You have 12 sets of ribs. The first 7 are known as true ribs, and then the last 5 are known as false ribs. The true ribs are directly connected to the sternum, whereas the false ribs are indirectly connected to the sternum. And then within your false ribs, your last 2 ribs are called floating ribs because they're not connected to the sternum at all. They're just floating here. And then within the sternum, you have your mandiburum of the sternum, which is up at the top, the body of the sternum, which is right here, and your xiphoid process, which is right here at the very tip of your sternum. So that is the axial skeleton. We're going to move on to the appendicular skeleton. So the appendicular skeleton consists of your upper limb, your lower limb, and the girdles that connect the 4 limbs to your axial skeleton. So that's your pectoral girdle and your pelvic girdle. So your pectoral girdle consists of 2 clavicles, commonly known as collarbones, and then you have 2 shoulder blades, which are called scapulas. And then within your arm, you have your humerus, which is the biggest bone in your arm. And then moving on down, you have your ulna, which is the bone right here, this one that is more medial to your body. And then you have your radius, which is the bone right here. And then moving on down, we have our carpals. So our carpals are, it starts with your carpals right here. These are your wrist bones. There are 8 carpals in each hand. And then you have your metacarpals, which are the long bones of your hand. And then finally you have your phalanges. These phalanges are the bones of your digits or your fingers. Within the phalanges, you have your proximal, your middle, and your distal phalanx. Moving on down to the next girdle, we have our ilium right here, otherwise known as your hip bones, and then you have your ischium right here, and your pubis right here. So this girdle connects your lower limb to the axial skeleton. Your lower limb consists of your femur, which is the biggest and strongest long bone in your body, and then you have your tibia, which is the bone right here, and your fibia right here. And then moving on down to your foot, you have your tarsals, which are the short bones of your ankle as well as your heel. And there are 7 of those in each foot. And then we have the metatarsals, which are the long bones of your foot. And then you have the phalanges. Your phalanges also have a proximal, a middle, and a distal phalanx. The big toe only has a proximal and a distal phalanx. It does not have a middle phalanx. So with that, that is the bones of the axial and appendicular skeleton. And thinking about the skeleton in regards to clinical settings and why it's important to know the skeleton really well and understand the bones of the body, I'm going to physical therapy and thinking about why this is relevant to physical therapy. Something that I thought about was with surgeries and dealing with orthopedics within physical therapy. It's really important to understand the bone structures and further to understand how the bone structures are related to joints and muscles so that you can best understand how to help your patient move forward after an injury and or a surgery, and how to get them back to their working order and back to their functioning selves. So figuring out how to best help them, how to exercise them best, is really important to understand all the bones in the body and how they work. For this video, I used the 9th edition Pearson Anatomy textbook as well as Pearson channels. Thank you so much for listening.